Oh my gosh, girl, I just got these new shoes for the run next week. I'm so excited. Let's go hit the gym.
Sounds good. Let's go. I'm gonna be doing cardio today.
I'm gonna go hit the legs.
Alright, sounds good.
Ow, Belgian!
I'm gonna come home in just a bit. I'm actually at the gym with one of my friends.
Belgian, it hurts so much.
What happened?
I don't know, man. It
What
hurts.
happened? Where does it hurt?
I don't know, man. My foot slipped and it's burning.
So where does it hurt?
My knee.
Come, let's try to get you up.
Oh my god, I feel like something's grinding at my bone.
I think you just need to go home and sleep it off, to be honest.
Let's go.
Yo, do you remember in kinesiology class we learned about this acronym? I forget what it was called.
Pier?
I think so. Well, like P for pressure, I for ice, E for elevate, and then R for est. I think we should try that. Maybe it'll actually work.
Hopefully it works. It hurts so much.
Yeah, okay, rest. I'm gonna go get you some
So
more.
much.
Here's a hot towel. Maybe you should try putting this on.
Wait, no heat. It'll increase the swelling, remember? It's supposed to be ice.
Here, try the cold one instead. And you know what else? I think we should elevate the affected area above the heart because I'm pretty sure it helps.
Let's try it. My knee.
I know.
Oh my god. It hurts.
Yo, do you think you're gonna be able to hit the gym tomorrow? Because you really need to prepare for this run.
Yeah, I'll be okay. I'll sleep it off.
Okay. Well, good night. See you tomorrow.
Bye.
Hey, good morning. How you feeling now?
I don't know. I haven't tried moving it yet.
Well, I think it's an acute injury. I think you'll be fine if you just do some light training.
Let's go to the gym.
Yeah, let's go.
I can't move it.
Maybe we should go to the doctors.
Really should.
Yeah, okay, let's go.
Oh my god.
Yo, you good?
Yeah, let's go.
I really hope this is not something big.
I won't be able to run.
I know, man. It's fine. It'll be okay. Let's just go to the doctors.
Let's go.
You know that the human body, like at the beginning, has like 300 bones, and it's mostly just cartilage. So over time, it fuses together, and it's left with like 206.
That's so
I
cool.
know, right?
Hello, ladies.
Hi.
How can I help you today?
So yesterday I was working out and my foot suddenly just slipped and my knee has been killing me. Like I can't move it.
Which one is it? This one?
Yeah, this one.
Okay. Let's get you on the chair and we can take a look at it, okay? Alright. Do you feel some inflammation here? Like where?
Like right over here.
Okay. How does it, what type of feeling are you getting? Is it just inflammation?
It was burning at first and then after felt like something was like grinding against my
grinding
bone.
against it? Okay. Let's take your heart beats pretty fast.
Cause I'm in pain.
Okay, BP normal. Alright, so by looking at your symptoms and like examining them, it looks like you have patellofemoral syndrome.
What's that?
Well, have you heard of runner's knee?
Yeah, I have.
Well, runner's knee is simply like a repetitive stress on the knee joint that can irritate the kneecap or the patella. So simply what you have is your outer quadricep muscles, right? And when you're exercising, you're simply making these muscles grow bigger than your inner ones, and that's causing stress on the patella.
That makes sense.
That's why when you slept on the machine, what happened was it kind of like irritated the patella and caused it to kind of shift, and that's kind of like what led up to it. So runner's knee is simply a long-term injury, meaning that you've had it for a very long time. And when you slept, that's what caused it to kind of get even worse.
So do you think she'll be able to run next week?
Well, patellofemoral syndrome is a overuse injury. So you've overused your knee to the point where it's just like can't bear the stress anymore. So it really does require rest. I would say that you probably need 1 to 2 weeks of rest just to make sure that it doesn't become like a chronic. Alright, so after the 2 weeks, I would totally advise you to kind of change up your routine, because if you continue running, it's gonna kind of bring back that stress, and you don't want to kind of go through that pain again. So do other forms of cardio. So change it up. There's always so many exercises that you can look up online. So I'll also prescribe you medicine, and you can get this. It'll help relieve the pain. But yeah, rest up and you'll feel better.
Thank
Okay.
you.
I want to learn more about patellofemoral syndrome. Let me search it up. Here's this article.
Let's watch a video instead.
Yeah, you're right.
Patellofemoral syndrome, also known as runner's knee, is resulted by common daily activities that load the patellofemoral joint, such as running, stair climbing, squatting, kneeling, and more. The articulations involved within the knee are formed by the patella, more specifically, the tibiofemoral articulation, which deals with the medial and lateral condyles of the femur, and the patellofemoral articulation, which includes the anterior aspect of the distal femur articulating with the patella. The tibiofemoral joint is the weight-bearing joint of the knee. Both joint surfaces are lined with hyaline cartilage and enclosed with a single joint cavity. The knee joint is an example of a modified hinge joint or an ellipsoid joint. The movements allowed are uniaxial, allowing for movements like flexion and extension and a small amount of medial and lateral rotation. The meniscus found within the knee are a C-shaped cartilage pad between the two joints formed by the femur and tibia. The meniscus acts as a smooth surface for the joint to move on. Causes of the injury include overuse, overloading, and misuse of the patellofemoral. How to treat it is very simple. Rest knee to switch up the fitness routine. Stay away from stairs, squats, or bending. Prescription drugs, including Advil and Tylenol, may be used to relieve inflammation and any pain. Physical therapist and RICE, rest, ice, compression, and elevation. The ACL originates from deep within the notch of the distal femur. Its proximal fibers fan out along the medial wall of the lateral femoral condyle. There are two bundles of the ACL, the anteromedial and the posterolateral, named according to where the bundles insert into the tibial plateau. This injury falls under the knee or the tibiofemoral articulation. The type of joint is a hinge joint or a modified ellipsoid joint. Thus, the movements allowed are flexion, extension, and slight medial and lateral rotation. Causes of this injury are through sports or exercise that put weight and pressure on the knee, unexpected increase or decrease in speed and direction, pivoting with foot firmly planted, landing awkwardly from a jump, hard force hits the knee, for example, football tackles, and much more. The cure for this is usually surgery, which is used to substitute the ligaments supported by rehabilitation. Recovery, restoration, and repairment activities to aid in recovering period. Use of a brace may also be needed to secure the knee, and use crutches to withdraw from placing pressure and weight on knee. Most importantly, RICE must be applied: rest, ice, compression, and elevation.
That was a very informative video.
It was so interesting.
Okay, now I think you should just rest and I'll see you in 2 weeks, okay? Okay, bye. Feel better. Hey, good morning. How are you feeling now?
Oh my gosh, I haven't seen you in weeks.
I know, it's been so long.
I feel better now.
That's great. Let's go grab something to eat.
Let's go.
Oh my god, not again.